34 weeks of gestation. That's the first element. The child is greater than 34 weeks of gestation, or the child is greater than 34 weeks of gestation. Is it clear? The element that you have to do when the child is 34 weeks of gestation, you consider that the lung is mature. So in order for you to, when the child is greater than 34 weeks of gestation, the first element that you have to do is to confirm that the child is actually greater than 34 weeks of gestation. And how do you confirm? From the history, you have the first kicking in. When the first kicking in, or the first fetal kick, is it clear? The first fetal kick usually corresponds to 16 weeks in multiparous and 18 weeks in nulliparous. So the mother can tell you the date of her first fetal kick, and when she knows the date of the first fetal kick, it can also tell you it can approximate for the gestational age. We have the last menstrual period. The last menstrual period can help you also approximate for the gestational age. We have the sinusoidal height. The sinusoidal height can help you approximate for gestational age. As we have said, gestational age is approximately sinusoidal height plus or minus 2 weeks. When the fundus is below the umbilicus, let's say the fundus is below the umbilicus, it is sinusoidal height plus or minus 2 weeks of gestation. But when the fundus is above the umbilicus, it's sinusoidal height plus or minus 4 weeks of gestation. The gestational age corresponds to that when it's above the umbilicus. So those are the different elements. So you confirm first, and then the last element to confirm that the gestational age is actually greater than 34 weeks, you have to use the first trimester ultrasound. Is it clear? Generally, that's the most precise ultrasound, the first trimester ultrasound, which can also help you to say which gestational age, confirm the gestational age of the fetus. Is it clear? Now, after confirming the gestational age of the fetus, the next thing that you need to do after confirming the gestational age of the fetus is to also evaluate for the bulbous shake test. Is it clear? Do the bulbous shake test, or you do even the listing syndrome ratio to actually see if there is lung maturation or not. Is it clear? So those are the different elements that you have to do in order to know. So now, if the patient is having actually lung maturation, confirm the gestational age, you can deliver the child by induction of labor. Is it clear? You deliver the child by induction of labor, provided the child is more than 34 weeks of gestation. Is it clear? And you have confirmed the gestational age. Now, provided that you have intrauterine growth restriction, is it clear? And you have the intrauterine growth restriction, you can evaluate also for induction of labor. Is it clear? Induction of labor. So intrauterine growth restriction can be an evaluation of induction of labor. Those certain obstetricians do not like to induce labor when the child is having intrauterine growth restriction. What certain obstetricians like is that when the child is having intrauterine growth restriction, they place the patient on tocolytics in order to prevent labor from starting, and then they continue monitoring for labor for 2 weeks, such that the fetus can grow inside the uterus. Is it clear? When the fetus grow inside the uterus, it can mature and it can actually increase the weight of the child to prevent that intrauterine growth restriction. Is it clear? So those are the different elements that you have to evaluate. So those are the complications that you have seen. Now the next complication is the infection. Is it clear? For infection, you need to prevent infection and you need to treat infection. To prevent infection, you can just do with general measures by preventing excessive vaginal examination. When you're in the latent phase of labor, normally the vaginal examination should be done every 4 hours. But in the case of premature rupture of membranes, in latent phase of labor, vaginal examination is done every 6 hours, and similarly with HIV. Now, similarly, when you have an active phase of labor, vaginal examination normally have to be done every 2 hours. But in the case of premature rupture of membrane, in active phase of labor, vaginal examination is done instead every 4 hours. Is it clear? So those are the different elements that you must know. Is it clear? So those are the methods you may use in order to prevent for infection. Now, if there is infection, or you can also use prophylactic antibiotics, particularly the antibiotic that is going to target the normal flora of the vagina. Is it clear? And you need to know that the normal flora of the vagina is lactobacillus, and which is targeted by penicillin, example amoxicillin. Now, in order to treat, if you you want to treat now infection, provided you have seen that there's actually an infectious process with a cultural sensitivity or even with a full blocker on the CRP. Now, in order to treat, you treat the patient in two ways. You treat the local spread of the disease, you treat the local spread of the disease, and you treat the systemic spread. Is it clear? Treat the systemic spread. Now, to treat the local spread of the disease, what is required? We need to deliver that child, is it clear, in order to remove the point of focus. Is it clear? So we need to treat the point of focus, and that point of focus is that portal of entry at the level of the amniotic sac. So in order to treat the point of focus, you need to deliver the child, and immediately you deliver the child has to be admitted in the neonatal unit and has to be managed with broad spectrum antibiotics to prevent early onset neonatal sepsis. Is it clear? Now, for the systemic spread of the disease, when you have systemic spread of the disease, what you need to do is that you need to give IV antibiotic therapy to the mother, and those IV antibiotic therapy are treated with the microorganism in the normal flora of the vagina. Microorganisms in the normal flora of the vagina are things like lactobacillus, which are targeted by penicillins. Is it clear? And we have other microorganisms like enterococci, which can come from the feces. Is it clear? And is targeted by gentamicin, which is an aminoglycoside. Is it clear? So those are the different things that you need to give for the management in this patient for the infection. Is it clear? Now, the next thing after managing the infection, is it clear? So you need to know now that you can have also other complications. The other complication that you can have is preterm labor. Is it clear? This is the next complication you can have. Now, when you have preterm labor, you need to know that you need to use tocolysis, provided that you don't want to, you have started long maturation. Is it